Hi, my name is Elena Voorand and welcome to Community Unwrapped. Thanks for joining and learning about what it's like being a dentist. So follow me. I'm now currently working as a general dentist in Toronto, and what led up to that was 12 years of university. I did my undergraduate at Queen's University. I did that in biochemistry. I turned that into a master's degree, and that took me down a lot of paths where I did around 5 years of cancer research. I got to go down into the US and take my research there, and then the 3-year master's degree was at McGill. I applied to dental school and got in, and so I did my dental degree at Western University. As a general dentist, we have so many different specialties we have to be at least relatively well versed in. Root canals, fillings, surgeries, implants, gum surgeries, general gum health, and sometimes it's unexpected, so you just have to be ready to deal with what happens during that time. The multitasking part can be tricky, but at the same time, that's why I got into this. I like to be on all the time. It's really fun to, maybe from a personal standpoint, work with my hands. So I love, breaking things down, so removing cavities, removing disease, and then building it back up and making it beautiful. It's very satisfying to go through that process. If you like working with your hands, if you like working with people, if you see yourself in the healthcare field, then pursue it. And the best way to find out if you do like doing something like that is to shadow people and ask people in your community, for example myself, if anyone ever wants to shadow, you're welcome to come and shadow, understand what happens every day. That was how I figured it out, shadowing dentists in my community at the time, and then volunteering with some of the dental outreach programs. Okay, so come on over here, I'll show you. This is one of our newest pieces of equipment. So this is not only a panoramic X-ray machine, but also a CT scanner. So what this equipment does with the panoramic X-ray is what we typically take where we need to see all of the jaw and sinus areas as well. And then the CT component, which is a little bit more advanced, what it does is it allows us to see in 3D all of the bone and tissue and what is surrounding that area. So we use that mainly for implant planning, wisdom teeth surgery, things like that. It's a nice piece of equipment to have in this office. Not a lot of offices have it, and it's great for the patients because instead of having to go to a different place and be referred out, they can same day have that CT scan done here, and then they get to know what treatment do they need sooner than later. So then our next piece of equipment here, this is, let's start here, the 3D printer. So this helps us to make anything you'd like to make in 3D happen. So in our case, most of the time we're making night guards, so that would be the common thing to make. But we can also print models of everyone's teeth and do some of our treatment planning from that. And then we also have here, this is our milling machine. So for patients that come in for a crown, we're able to scan the person in 3D and then go ahead and mill that crown within the same day. So your appointment looks something like the first hour is preparing the tooth, and then once it's scanned in 3D, we can then mill it here, and then try that in right away, which is great. Usually it takes about 2 weeks if you were to send it out to a lab for that crown to be made, whereas here we get to have our hands on exactly how it's designed, and you get to try it on the same day. This will be step 1 so that we can make a 3D model of your teeth. And the way it looks like, apparently this one looks intimidating, but the idea is that you're able to go along the tooth surface and record in 3D down to less than a millimeter detail what that person's mouth looks like. So once you're done scanning, we'll have the whole smile here. So this is an example of what we would start with to make a crown. So it starts as a block like this, and this block is inserted into the milling machine that we were talking about. And this turns into this tooth here. So this would be a final crown that gets cemented into someone's mouth, and it's perfectly fitted to their mouth and the neighboring teeth. Thank you for joining me today and learning about what it's like to be a dentist and everything that goes on here. I hope you learned something and are excited to go visit your dentist next.